in India, more than diabetes is increasing day by day. We have even got the title of being the diabetic capital of the world. And I think 1 in every 10 adults today have diabetes.
Genetics is a point where, as Indians, we are metabolically more inclined to these diseases.
It is now that our lifestyle is changing, and that's impacting, the fact that we are developing more diabetes today. Is that also the reason that, younger population is actually getting diabetes today?
Downwards, and now includes a lot many young people.
That's actually very terrifying.
Yes, it is.
Welcome to Center for Eyesight's very own podcast. Imagine living with a condition for years without even knowing about it. Now, this is the harsh reality of people battling with diabetes. Today, globally, more than 500 million people are affected with diabetes, and this number is only growing yearly. So today, in our podcast, we will be diving deep into understanding what diabetes really is, how it impacts our lives, and what can we do to prevent it. To discuss this, we have with us Dr. Arundhati Dasgupta. She is a well-renowned endocrinologist and dietitian, and she has an experience of 25 years and is a director at the Rudraksh Super Speciality Hospital. So, welcome Dr. Dasgupta. We are very honored to have you here with us to discuss on this very important topic of diabetes.
Thank you. It's an honor to be here.
Thank you, ma'am. So, ma'am, let's start with looking at the bigger picture. As you know that in India, more than diabetes is increasing day by day. We have even got the title of being the diabetic capital of the world, and I think 1 in every 10 adults today have diabetes. So why do you think we have become a global hotspot for diabetes?
Well, yes, you're very correct that India today stands very high. We were the diabetic capital. Now we're the second. We had the second highest number of diabetics in the world.
Okay.
But that doesn't make the burden any less, though, because the numbers are growing exponentially every year.
Right.
And as you have said, around the last statistics told us that around 10% of our population, 10 to 11% of our population are diabetic. And another 13 to 14% of our population are pre-diabetic. So that makes a total risk of around 24% of our population. That's 1/4 of our population who have either diabetes or pre-diabetes. Now, if you ask why, the first answer is, of course, genetic. When you're talking about diabetes, genetics plays a very, very important role. So genetics is a point where, as Indians, we are metabolically more inclined to these diseases, to hypertension, to diabetes. So we also have a structure. Our structure is such that we are called the lean fat Indians. So because you'll see generally, our people are not obese as such, if you compare it to the West, but we have a lot of visceral obesity, that is abdominal obesity. So we have this pear-shaped structure. That is basically one of the reasons, because this fat is really the bad fat and causes a lot of metabolic complications. So we have this genetics wherein we have an increased propensity to develop diabetes. We have a structure which is, kind of dysmorphic, which is not I would say, which has a problem in terms of genetic repercussions. And now what is happening is that because we are adopting a different lifestyle than what we were used to maybe about 50 years back or 70 years back. So our eating pattern is changing, our living pattern is changing, our sleeping pattern is changing. Yeah. So over and above that inherent genetics that we had, now these environmental factors are coming up in big time. So that is why what we're seeing is that there's a huge surge in the number of diabetics in our country. It's also happening across the world, but it is more marked in certain areas of the world, and India is one of them.
Oh, very well explained, ma'am. So, ma'am, as you mentioned that it is now that our lifestyle is changing, and that's impacting, the fact that we are developing more diabetes today. Is that also the reason that, younger population is actually getting diabetes today?
Yes,
as
of
compared to like 50 years back, or maybe
Yes,
30 years
yes,
back?
yes. I mean, when we were students, maybe MBBS students, we knew that diabetes is a disease of the elderly. Then
Right.
it came down to middle age. And now today we are seeing diabetes amongst adolescents, amongst
Really?
teenagers. Yes, yes, plenty.
Teenagers?
Oh yes, in schools, when we are doing these screening programs in schools, we are detecting a lot of diabetics because of a lot of changes in the environment, of course,
Right.
because of the sedentary lifestyle, because children nowadays do not go outside and play. All they do is, play in the mobile or the laptop.
Right.
And the eating pattern, there's so much of junk food in the food that is being consumed regularly from the time that they are young. The first time when they're going outside, it's no longer roti sabzi, right? It's
Yeah.
all about the junk food. It's all about the packed food, the high, the carbonated drinks.
Correct.
All of this put together. The genetics factor was always there, but because this entire lifestyle change has happened over the last 50 years or so, that is why there's been a major shift in the age group also. And this is again not peculiar to India, but as I said, we are more prone to developing diabetes or developing cardiovascular diseases. So that is why this burden has shifted. The age spectrum of this disease has basically shifted downwards and now includes a lot many young people.
That's actually very terrifying.
Yes, it is. It is.
So, ma'am, let's start with the basic, and let's try and understand what diabetes actually is, like what it is. Why do people develop it? How do people develop it? You've already mentioned one very big reason, which is genetics. But yeah, let's understand what diabetes is.
So, we have a hormone in our body, which is known as insulin, and that's secreted by the pancreas. Okay. We have this organ known as the pancreas that's located in the upper abdomen. So when you consume carbohydrates, this insulin is immediately secreted in the body, and that is responsible for shifting this carbohydrate inside the cells. So the blood sugar, as we know it simply, is basically pushed into the cells by this insulin.
Right.
So what happens in diabetes, and we're talking about type 2 diabetes first, is what is this insulin is unable to perform its function. So there is something which is known as insulin resistance. So because of this, the body tries to compensate by secreting more and more insulin. But at a point, what happens is that even though the body is secreting a lot of insulin, it's unable to perform that function adequately. So the blood sugar remains high because it's not going inside the cells, and the cells are deprived of the nutrient. This blood sugar is basically the nutrient for the functions.
Right.
So the cell remains deprived of these functions. So when you're testing the blood sugar, the sugar levels come out high.
Okay, so in simple language, I would say that there's the sugar that was supposed to go from my blood to my body cell is not going.
Is not going inside the cell.
Inside the cell.
Yes.
So which is why the sugar in my blood is very high, and
Right.
that's when you say that I have diabetes.
Absolutely. So we basically have two types of diabetes, as you asked. Type 2 diabetes, which is much more common, which is around, say, 95%, 90 to 95% of the diabetics that we see. And that's basically insulin resistance. At least at the beginning, it's only insulin resistance. Later on, it's also about insulin deficiency.
Okay.
And type 1 diabetes is a condition where the body is unable to secrete insulin at all.
Oh.
Right. So that is why the treatment is entirely different.
Right.
So type 2 diabetes is basically a lifestyle disease. Type 1 diabetes is an autoimmune disease. It's not a lifestyle disease per se.
Okay, got it. Which is why people should be aware that, type 1 and type 2 diabetes is a very
These
different.
are completely different things, because type 1 diabetes, it has to be treated with and only with insulin and nothing else. And type 2 diabetes, of course, we have a lot of options.
Yeah, and what I'm understanding is, like, as you mentioned, in type 2 diabetes, your body is producing more and more insulin.
Initially,
but it's not like,
It's not enough to
being
make,
utilized.
Yeah. So what happens is, because the body is trying to compensate, your own insulin reserve is getting depleted.
Right.
So a person is manifesting as a diabetic only after, say, around 50% of the beta cells, that is the cells that secrete insulin, they have been drained. Okay. So from the 100%, when it comes down to around 50%, that is when the body is unable to actually take care, and the blood sugar levels start moving high.
Got your point. Okay. One risk factor is genetics. Another risk factor, as you mentioned, is the lifestyle changes. Do you think there are any other risk factors that people should be aware of, and something that they can, maybe avoid and maybe minimize it to reduce the risk of developing diabetes other than these two?
So genetics you can do nothing about.
Of course.
The environmental factors, basically, as we said, food, lack of exercise,
Right.
stress. And these are all things that you can work on, right?
Okay, so
you
stress is also a contributor.
Indeed. Yes. Stress, and then the change in the sleeping pattern. Nowadays, you would see a lot of people staying up late at night and waking up later in the day. So these have hormonal
I'd be guilty of
repercussions.
that.
A lot of people today, because it has become the trend, and it's
Correct.
more like my friend is also doing it, and I'm also following the same. Children today, these days, and I face it in my house also, they wouldn't want to get up in the morning and study. They want to
Yeah.
study till late.
Correct.
So this kind of change in the basic patterns have an effect in terms of what's happening to your hormones.
Right.
And the hormones that kind of surge your blood sugar levels or surge the metabolic complications are higher. So
Right.
that can be avoided. So, as I said, you cannot do anything about the genetics, but you can certainly do a lot about the entire environmental area, whether it's food that we're talking about, or it's exercise, or
Definitely.
it's some amount of stress you cannot avoid.
Yeah.
But some of it is avoidable. You can kind of choose not to react to it, or there are so many aspects of
Ma'am,
looking
I
at
think
it.
one more thing that, as you mentioned correctly, that you can manage your environment. I think when I step out of the house, junk food is so readily available.
yes.
But the healthy food, we always associate healthy food with like boring food.
Mm-hmm.
And that's become the trend. And that's why, people are more, because of the easy access, we are more prone to eating junk food when we're hungry and we are on the go.
And also because
So-
it's being introduced very early in life.
Correct.
So when the child is growing up, we are handing over the packet of chips to him, or the the beverage or the
Yeah.
juice, and it is we who are introducing them. And that is what I always tell parents, or when we go to schools and all that once you have got them accustomed to this, you suddenly cannot take it all away and say that, okay, now
Definitely.
start having healthy food. They're not going to do it. So the entire aspect of looking at food and looking at exercise needs to change.
Yeah. I think that needs to become a daily lifestyle.
Yes.
And that has to start from home.
From home, absolutely.
Correct. So, ma'am, diabetes, as we know, is not just about managing blood sugar levels. Once you have diabetes, it can affect every other organ in your body. That's what I understand. So, can you shed some light on that?
So when we were students, we were told that if you know diabetes, you know the whole of the human body, because there is not one single organ in the body which is left, when it comes to complications of diabetes. Some organs are more affected than others, and some are a little less. But at the end, if you have uncontrolled sugar levels, you have complications in your eyes, in your heart, in your nerves, the kidney, the brain, your skin, everywhere. And you talk about name an organ, and the liver. So diabetes is a silent killer. We call it the silent killer disease, because very silently, very subtly, without the patient even understanding about what's happening, all these organs can be affected. And that is why, had there been pain, the moment supposing the eye is affected, if there would have been pain, people would have been aware. They would have got themselves tested.
Correct.
But because it happens so slowly, and by the time the patient starts getting symptoms, whether it is the eye or the kidney, it's already much
late.
advanced. Yeah. And there is not much you can do about it.
Yeah. Actually, when you're talking about this, at our hospital, we've started seeing a lot of cases related to diabetic retinopathy. A lot of people come in with retinal damage, and they come at a stage where, it's kind of irreversible.
Yes.
Right? So, let's focus a little bit on, eye and how diabetes affects eyes. So, is it true that, people with, obviously, diabetic retinopathy is something that we know is directly related to diabetes. But does it also increase the risk of cataracts in...
It does. It does. Yes. Uncontrolled diabetes has a very strong relation with cataract, early cataracts, with glaucoma, with a lot of infections in the eye. So, yes. And retinopathy, I mean, a lot of people do know that the retina might be affected, but even then, they do not get themselves tested.
Correct.
Now, when we are seeing it from our end of the spectrum, where we're treating the blood sugar levels, the patients come to us, and most of the time, they want us only to focus on the fasting PP HbA1c.
Yeah.
Now, when we tell them that you need to get this yearly test done, they think that it's just a wastage of money till the time something is detected. So like, I have patients telling me, ma'am, you get this tested every year and it's normal. Why do you still go on testing? So they have to understand that we cannot wait for the symptoms to happen. There are certain tests that need to be done at least on an annual basis.
Correct.
So, and eye testing is one of them.
Yeah.
Why you're seeing them at the end is because generally they'll be having diabetes for 10 years, 15 years.
Yeah.
And they'll not have a single eye test done in that entire course. It's only when they're getting the floaters or they're having some problem in vision, acute loss of vision or a major problem in vision, that is when they're going to come to us and say, okay, now I need to get my eyes tested.
And with retina, ma'am, it's like the heart of the eye.
Yes.
And once, the nerves are damaged, if there's hemorrhage, there's only so much you can do to recover, only so much vision.
That is what we keep telling them. You know, by the time if it's a maculopathy or it's like a proliferative diabetic retinopathy, there's really not much to be done.
You can do.
Yeah. If you detect it early, say we do tell them it goes through the mild, moderate to severe, without maculopathy, with maculopathy. If we can detect it in the mild stage, then you'll know what to look out for.
Yeah, and we can treat it with drops, something as simple as that.
Absolutely. And so it's not just so very, very strongly the message should go out to all people, who have diabetes and all caregivers of diabetic people, that it is not enough to just look at the fasting PP and HbA1c. Annually, these tests need to be done. And if they are good, very good, excellent. But if they are not, then you'll be able to take the proper measures at the correct time when things can be reverted. But after a certain point, it's that irreversible phase, and you really cannot do much to help them.
Correct. So can you share some of you've had such a long experience of 25 years. So can you share some of your experiences with any of your patients? I'm sure you've seen a lot of diabetic patients and they must have come up with a lot of complications, something that was preventable, so that, we can paint a picture for our viewers that how they can prevent such diseases from happening because of diabetes.
So, we've had patients with I'll tell you about the eye, but let me tell you something about the nerves first. Yeah. So I had this patient who was coming to me for quite some time, and she every time I told her, you get your nerves tested or your feet tested, she was like, no, I don't have anything there. I'm not going to look into that. This is just a wastage of money. And that's it. So she didn't bother ever to get her nerves tested. And you do know the diabetic neuropathy, what happens is that the sense basically, the sense basically gets depleted over a period of time. Right. And so this patient did not realize that her sensation was pretty gone. And she had gone to a seaside, and she had, she was walking on the beach, and there was one of those things that kind of, she hurt herself. And because the pain sensation is gone, generally when you hit something which is sticking there, you take your feet off. But because she's not feeling it at all, she just stepped on it and it stayed on that stone or pebble or whatever. Okay. And then she developed an infection and a gangrene, and eventually had an amputation of a part of her feet done just to save her, because that had to be done to save her.
Yeah.
And all of this could have been avoided if she would have done that nerve testing, annual nerve testing, to know that her sensation is gone, and she would have been careful about it. She would not have walked bare feet, because then we would have told her that, you do not have enough sensation for you to walk bare. So these are things. And eye-wise, we keep on seeing patients where they come back and, a lot of the vision is gone. I have a patient who is actually, unfortunately, both his eyes, he's lost his vision, and is very minimal. He needs help when he's coming and all. And he is a very strong voice when it comes to telling other people. So we've had awareness sessions with him where he actually speaks out and tells the other people how necessary it is to get yourself tested and treated on time. Because he was tested and he was diagnosed also, but he kind of deferred the treatment, like, okay, I'll come back after 6 months or 8 months. And by the time he came back, unfortunately, there was not much to be done. So we hear these stories and we see these, things happening all the time. And all of it because of lack of awareness. Because people take diabetes so very easily. And they think it's like, that's the last thing to be cared about. So
I think the biggest problem is internet. That's
wrong information. Indeed, that's Now I've stopped getting angry, because initially I used to get very worked up. What on earth? Who gives you this kind of information? They'll stop all medications and stick to all kind of totkas and all that. It's fine. You follow good diet, fine, but do not stop your medication. Consult your doctor. Correct. Look at your levels. And all the time, when I tell my friends that I have patients coming with 500 and 600 sugars, they're like appalled. It must be happening rarely, they tell me. I said, no, it happens very often. Almost every day in my OPD, I would see one patient who has a sugar level in the tunes of 500 or 600.
Ma'am, even for our cataract surgeries, a lot of time we have to cancel the surgeries because the sugar is 500 and 600.
Yes.
That's, it's very surprising.
And they're blissfully unaware. They just,
That's true. Okay, ma'am. So moving on, let's, talk about some myths and misconceptions now that we've spoken about the internet. So what do you think are some of the biggest misconceptions people have when it comes to diabetes?
So misconceptions about diabetes, I would say number one is related to treatment, of course. A lot of them think that, once you've taken the medicine, I'm not going to take the medicine because it's for life. And the point is that diabetes is for life. I mean, generally diabetes cannot be reversed. It's not because that you're taking the medicines that you become addicted to it and hence you have to take it. And that's more relevant in terms of insulin. There are so many people who need insulin, but they'll absolutely refuse to take it and, keep their sugar levels very high because they think that once I take this, it's going to be for life. Yeah. So that is one thing. And secondly, I mean, people, this misconception that, my father had diabetes and, his kidney was not affected. He didn't bother about his food and all. And so hence I am also not bothered. That kind of thought process.
I think what they don't understand is our fathers, our grandfathers had a very different lifestyle.
Very different life. And it's definitely not going to be the same for everybody.
Exactly.
You can have a very different picture when it comes to this thing. Food is another, misconception where zameen ke neeche ka cheez nahi khana. That is the general concept. I mean, I don't know where it evolved from, but it is not
even
true.
For fruits, I think.
Yeah, fruits. I mean, what kind of fruits? So you basically need to understand there's nothing called zameen ke neeche ka sama. I mean, there's nothing like that. There's carbohydrate that you need to, cut down on, simple sugars that you need to avoid completely, complex sugars in limited amount. So food is not just aloo. They'll tell you about I'm not having aloo, I'm not having chini, but I'm having gur. So that's like. That's all kinds of misconceptions that it's not only chini, it's only sugar.
I think we can do one entire episode on this.
Yes, and rice. I mean, rice becomes the culprit, and then they'll say that, I don't have rice, so I don't know why my sugar levels are going up.
I think it just needs to be balanced.
So you ask them, what are you having? So say, I had 6 rotis. So if you're having 6 rotis, you might as well have rice. I mean, it's not about rice or rotis. So they need to understand about the basic concept of what is it that I need to avoid? Why do I need to avoid it?
And what do I need to replace it with?
Yes, and how do I need to balance it? So you need to have, in places where available, you need to have a diabetic educator or a dietitian who knows the subject, who can tell you exactly about how to balance your things, right?
Right. Actually, that's very important. So, ma'am, coming to our last segment of the episode, we'd like to talk about lifestyle and management. So, as you already mentioned, food plays a very important role. Do you think, can you tell us a little bit of, pointers for our, small crisp pointers that people can take to manage diabetes?
Like in terms of diet?
Yeah. No, in general, like diet is one. Say, for instance, stress management.
All right. So number one, diet. Just work on your diet. Supposing you've got a family history of diabetes, you have parents who are diabetic or, close relatives who are diabetic. So keep a watch on your diet from the very beginning, not like after it sets in. And, obesity is something that we laugh about, I'm trying to lose weight, but I'm not losing. Or, be very casual about it. It's not something to be laughed at about.
And obesity and fat shaming don't go hand in hand. This is something I really want to...
Of course. Yeah. I mean, it's not about shaming at all, but you must be aware that...
It's about being healthy from
It's about being healthy, right? You need to be healthy. So from the very beginning, you need to be careful. It's not like you're going to have only boiled food, and that is not boiled food is not healthy food, mind you. So you can have very tasty food and at the same time it can be healthy. And from the very beginning, I would tell young parents that from the very beginning, do not encourage that westernized way of eating, because our initial Indian way of eating was actually very good. Yeah. It had a lot of fibers in it and lots of vegetables, with some things, our children avoid completely. They'll be only eating protein. In my house, I had a tug of war every day, almost like, only chicken, no vegetables. So, that kind of thing that needs to be inculcated.
Right.
That is important. Exercise, I think, if you properly exercise, I mean, you can keep so many things at bay. So just take out half an hour. We have people from both the ends of the spectrum, people in whom complications have not set in, and they'll say that, I have no time for exercise.
Yeah.
And at the other end, we have people who have developed the complications. They've got an eye damaged or a kidney damaged, and they would give any amount of exercise if they could revert it, right? So a little bit of exercise, half an hour every day, you can take out for yourself.
That's true.
So, and it would not, you do not necessarily have to go to the gym. If you're going, that's okay. But if you're not going to the gym, you just need to move, brisk walk for at least 30 minutes every day. Where you do it is immaterial.
Yeah.
When you do it is also immaterial. You might not be able to do it in the morning. You can do it in the evening.
Correct.
But plan it out at least 5 days a week. Go out for exercise, whatever form of exercise you can. And that's going to go a long way in keeping these things, away.
Definitely, yeah. That was very insightful, ma'am. So one last question before we go: what role do you think that schools can play? I think maybe they can work around diets, say for instance. And what would you like to say to our audience? Like in general, to make sure that they can avoid diabetes.
Schools, I think they would have a very strong role to play because that's where the foundation is. And one thing I would definitely like to tell school canteens, if you go to the school canteens, most of them do not have healthy food. What is available is unfortunately very high calorie junk food in a lot of schools. I would not say all, but in a lot of schools. So we could start off from there maybe. Maybe we could have a proper dietitian plan out a tasty yet healthy food for them. And I had my dietitian who was telling me, ma'am, please do these, courses in schools, but I want to talk to them.
Yeah.
There's so much of junk food available across in all these schools. So that is one thing. And maybe, sports should be a very, very important part. Today, of course, we are seeing positive changes. A lot of schools are bringing in sports very strongly. So that can be also inculcated very early.
Yeah.
And teachers, of course, teachers are role models. So, when teachers talk, the students will listen to them no matter what they say. So they can always have this small talk, a little bit, maybe 5 minutes, 10 minutes. And that would be a better way of, making them understand about what health is. In fact, in World Diabetes Day, we used to have an art competition. And, the theme was diabetes. So we had these very young kids who understood nothing about diabetes, but they had to come and draw something about diabetes. So their teachers taught them very nicely about what is healthy food.
Right.
And it was such a, and the teachers also told me that in this process, we are also teaching them something which is going to help them henceforth. So that's a good, way of, a good initiative. Yeah. So we could plan out small things, you could talk to people who
small
are in this.
Make big changes.
Yes. And you do not know how it's going to affect them and it's going to get incorporated in their minds as they grow up.
Correct. So, ma'am, one final last question. What would you like to say to our audience?
So, the only thing to be said is that basically lifestyle diseases can be prevented, and diabetes is a lifestyle disease.
Right.
It is very much a preventable disease. Now, it is very unfortunate that across the years, we are only talking of increasing numbers. Everybody knows about the risks, everybody knows what is to be done, and yet we are not doing it till it strikes us hard. Right. So let us not wait for, diabetes to come into our lives and take over, or the complications to set in. Let us start not only talking healthy, let's start working healthy, let's start eating healthy, let's start living healthy. Right. It's important that, and very importantly, as you said, one person or one doctor can do nothing. It's only when the entire society is at it. Now, I've gone to places where I've given talks and everybody's listened to me and at the end of the talk, we are eating something which is entirely unhealthy. So that is not going to help. Yeah. We need to understand that we have to be careful about our health because at the end of it, you're the person who's going to suffer, right? Correct. Nobody can take away your sufferings.
Correct.
So if you do not want to lead an unhealthy life, if you want to stay happy and healthy, start early. That is what I would say.
So thank you so much, ma'am. It was a very, very insightful session. And I think I also learned a lot today. Type 2, type 1 diabetes is something I didn't know about at all. So thank you so much for coming here, giving us your time. And for our audience, I hope you had you learned a lot and you think this was very helpful to you. So stay informed, stay curious. Remember, your health is your greatest wealth. And don't forget to like, follow, and share for more.